So I've just done 3 12-hour shifts in a row, and literally, like, I could hardly walk.
I was chatting to a lady last night, and she's wanting to go home and, like, just quite upset.
Those were some of the nurses working here on a COVID-19 ward, where you are expected to look after dying patients, work exhausting shifts, and run the constant risk of catching the disease yourself. For legal reasons, all the medical professionals quoted have been given anonymity. A nurse on a COVID ward in Devon talks about how difficult it can be coping with this pressure.
I'm almost like having to kind of distance myself from it a bit, just to like cope with it, because if you like think about it too much, it's like a bit too overwhelming. So like we've had like some deaths on the ward, and we haven't been able to have their relatives with them, and I can't like even think about it. It's horrible.
One doctor, the first man in Malta to contract the disease, says that he was forced to delete his Facebook account due to criticism, with people blaming him for catching coronavirus.
At the beginning there was a bit of COVID-19 shaming people, as if we had purposely gone out, got the disease to bring it back to the country. We are going to have a lot of psychological problems in people who might not do so well in isolation. And also the elderly who do not have the disease are virtually housebound. So many 65-year-old and elderly are staying at home, their family are not visiting them. So I think that's going to have a certain amount of psychological effects.
Nurses have also spoken about being unprepared for what was to come, and that inexperienced nurses were being given duties that they had not trained for.
Their first shift, everyone has been so scared, and it wasn't as we had expected. The support maybe wasn't as much as we were expected, and a lot more was expected of us. So the first shift for every person that I've spoken to, there's been almost tears. I'm just kind of under the impression that like these are unprecedented times, and we've kind of got to just keep chipping away at it.
That was an ICU nurse working in London. Before this pandemic, she had only worked in paediatrics before, but now she's on the front line of the worst epidemic in recent history. Patients who are soon to pass away are being cared for until the end, but often this is traumatic for the nurses tasked with looking after them.
We've got a patient who we think is going to pass away, and his daughter rang up asking if he would be able to speak to her, and I said he's like too drowsy, he won't be able to speak to you, but he will probably be able to hear you. I said, so I can take the phone to him and put it up against his ear, and you can like just like say you love him and stuff. So I did that yesterday, which was like, yeah, it's not nice, to be honest, but I'm just trying to do my best, really.
Many of those being treated in hospitals were previously very healthy. This has been a harsh surprise for many nurses who expect the majority of patients to be elderly or have pre-existing medical conditions.
They're all our parents' age, so you're 54, 55, like my mum and dad, like it's kind of like not what you expect. So this is definitely a lot. It was a shock to see how young people are. And when I had a patient that was 32, and being 30 myself, I was kind of like, wow.
Despite the crisis now coming to an end, the impact on mental health will last for years to come. Michael Saliba reporting for Just News.